Hello everyone, I am Dr. Naveen Kumar LV. I am a senior consultant in orthopedics and sports injuries at Manipal Hospital Sarjapur Road. Shoulder impingement or shoulder pain and problems, very common problems in the middle age. Why do we get it? It's because of multiple reasons. So one is because of a bone on the top here, which is called acromion bone, that can be a bit slopey downwards in some people born with that. That can be one of the reasons. A lot of us, our work is mainly in terms of sitting with our arms rounded like this. We are not squared up enough. That can also add on to narrowing the space there between the actual shoulder arm bone and the shoulder roof. So that narrows the space and causes this problem. Shoulder impingement is because of the tightness between the two bones in the shoulder area. If you look at the things here, beneath the deltoid muscle, which is one of the biggest muscles, if we look, we have got the actual shoulder joint and we have got the roof of the shoulder. So the space between these two, when it gets narrowed, that is called shoulder impingement. So when we lift the arm up in certain angles and directions, this bony bump needs to go inside, where if the space is narrow, the bones rub against each other and the muscle in between gets irritated, which is supraspinatus. So because of this, one would get impingement and impingement related pain. So when we have this particular problem where the tightness is there, the arm when it has to be lifted up in certain angles, especially in the outward angle, then there can be a bit of tightness, especially in the last part of the movements. When you take it through, then you will feel the tightness. This can keep causing pain when you are working, using your hand, cooking, stirring and all the things, or even when you lie down to that side, on that particular side, that can cause pain. So if it keeps on continuing like that, and if the impingement is going on for months together or even years, sometimes it can even lead to damage to the muscle tendon, which is called rotator cuff, which sits in the just in between the bones. So that's the worry. So if you pick up the shoulder impingement at the right time, treatments are a lot more simpler than what you think about it. So what we are talking about is you doing some simple exercises for this as well. All you need to do is apply some heat to the shoulder area and doing some simple stretching exercise, which are called shoulder impingement exercise, which can actually help in opening up that space by a bit. So by doing that, you can get a better outcome and the pain can be gone, but it may take few weeks of time for you. In people in whom, in spite of exercises, it doesn't get better, then we do a small dose of steroid injection to the subacromial space. That's the area beneath the bone and above that muscle, the dead space over there. And by doing that, we can make the pain and inflammation go away, so that you can go and again exercise and make it permanently cured for yourselves. Rarely, in a small percentage of people, about 1% of people, none of these modalities help, and we may have to go and do a surgery, which is a keyhole surgery called subacromial decompression, where we put the camera in and we shave off a tiny bit of bone which is actually digging into the muscle, and we also clear up whatever thickened tissue is there in the middle, so that the shoulder can move and glide freely again. These are the things which we need to do for curing this problem. Cure is there, of course, but do act at the right time, because if the muscle tears, then the kind of treatments which we do are going to be bigger than what you are thinking.